Today, we're talking about something almost everyone overlooks in chronic wound care, but it might be the missing link to healing. By the end of this video, you'll know what step you could be skipping and what to do about it. We've all seen it. A wound that just won't heal. The bandages change, the ointments get stronger, but week after week, nothing improves. It's often not the wound's fault. It's what we're not doing that's the problem. For those who don't know me, my name is Dr. Voltaire. I've treated hundreds of wounds, some tiny, some life-changing, and what I've learned is this. Healing isn't just about what we put on the wound, it's about what we understand about it. If you're a healthcare provider trying to help your patients, or even someone caring for a loved one at home, this is for you. No fancy tools needed, just clear, powerful knowledge that anyone can apply. In this video, I'll show you the critical step most people skip in chronic wound care, why it matters, and how to start doing it right away. What actually keeps a wound from healing? It's tempting to say infection or poor circulation, and while those are true, they're often symptoms of a deeper problem. Chronic wounds are often stuck in what's called the inflammatory phase. That's the part of healing where the body sends in its cleanup crew, white blood cells, cytokines, and enzymes to deal with damaged tissue. But here's the thing. Sometimes the body doesn't move on. It gets stuck in cleanup mode, creating a wound that's red, angry, and unproductive. That's where biofilm, edema, poor perfusion come in. The key is to step back and ask, what is this wound trying to tell me? Because a wound that's not healing is usually talking. We just have to listen. So what is a step most people miss? It's this. Addressing the underlying cause before picking a dressing. Let's say you walk into a room and see a wound that looks clean but hasn't healed in 3 months. You grab a hydrocolloid or a foam dressing because it looks dry or needs moisture, but has the patient been evaluated for arterial disease? Are they sitting or laying in one position for too long? Is there edema compressing the tissue? Could it be a cancerous ulcer or related to an autoimmune issue like vasculitis or pyoderma gangrenosum? This is a mindset shift. Treat the wound, but fix the reason it's there. Here's a simple tool I use, the VAIL framework: vascular, edema or infection, inflammation, and load. If one of those 4 isn't addressed, the wound isn't going anywhere. Let's break these down. Vascular. Is there enough blood getting to the tissue? If not, nothing will help, not even the fanciest dressings. We check this with an ankle brachial index, an ABI, pulse checks, or referral for vascular imaging. There's also edema. Excess fluid equals tissue suffocation. Imagine trying to breathe under a wet pillow. That's how the wound feels. Also compression. If vascular flow allows, can help, but only when done safely. There's also infection. Think of biofilm like a shield protecting bacteria. You might experience wounds that look clean, but they're not progressing. If it's been 2 weeks without improvement, suspect biofilm. So what are solutions? Regular debridement, antimicrobial dressings, and addressing systemic infections. Load, pressure, friction, and shear are other issues. For diabetic foot ulcers, a wound won't close until you remove pressure. A pressure ulcer won't improve until the patient is repositioned regularly. This is why pressure mapping and offloading are essential, not optional. Now let's make it practical. Ask the right questions. Don't just assess the wound, assess the person. Are they mobile? Are they hydrated and nourished? Are they able to offload the wound or use support surfaces? The next step would be to document your progress or lack of it. If you don't see measurable improvement in 2 to 4 weeks, escalate treatment. Bring in a specialist to reevaluate the diagnosis or request further imaging. Also communicate. I always say the best wound care plan is the one everyone understands and follows. Whether that's family, nursing staff, or the patient themselves, clear instructions matter. The next step would be to know when to dig deeper. Chronic wounds that don't follow the rules, especially with weird shapes, odd locations, or extreme pain, might be atypical. So think vasculitis, neoplastic ulcers, or autoimmune issues. Get a biopsy, get a referral. Don't delay. Wound care isn't just about being technical, it's about being curious. When I first started, I thought the right dressing would fix everything. Now I ask, what haven't I considered yet? Sometimes the missing step is compression. Other times it's protein. Or it's simply asking, how do they feel about their wound? Because stress, fear, and even loneliness can delay healing too. Chronic wounds are frustrating, but they're also puzzles. And once you learn how to look deeper, you'll start solving them in ways you never thought possible. So what's the takeaway? If a wound isn't healing, stop changing dressings and start changing your mindset. Ask the deeper questions. Look beyond the surface, and never underestimate the power of addressing the real problem. Thanks for watching. If you like this video, check out my next one on other sources of poor wound healing. Stay informed and heal well.